Okay, so what we're going to be doing today is we're going to be doing a urinalysis. The first thing I want you to notice is we've got 4 different patients and their urine is labeled as such. So just patient 1 through 4. And notice I have a pipette here. I'm only going to be testing one patient's urine. I've chosen patient 4, but you need 1 pipette for each one of these. So the first thing that we look at when we do a urinalysis is we look at the color of it. Notice how these are all slightly different. And then the other thing that we want to usually do is there an odor to it? For example, if somebody has diabetes, they tend to have sweet smelling urine. So that's another thing that we'll look at. But we'll also look at the transparency. So when I talk about the transparency, I want you to notice that I can basically almost read through this one, where this one is a lot more turbid or a lot more cloudy. So that's the other thing, is this is transparent. This one's a bit cloudy. So that's the other thing that we're going to be looking at when we do a urinalysis. And of course, we always write down those results. So when you do a urinalysis, we have urinalysis strips, and there's various different types. So this one that I have here is testing for just a few things. There's some that test for a lot more. Your worksheet will give you information on each one of those. And so what we want to usually do is we want to see what normal is. So this all the way on the left here tells us, the first one is testing for blood, ketones, glucose, protein, and pH. And this is what a normal urinalysis looks like, and these are going to indicate if something is has been detected. And so the way that we do this is we take one of these urinalysis strips. You take 1 per patient, and what I'm going to do is I'm going to use the pipette in order to transfer urine onto each one of these squares. And I will basically want to make sure that the squares absorb that urine and that each one has some of that urine on there. And I'm going to let it sit for 30 seconds because that's how long we have to wait when I'm looking at the test. Usually the one at the bottom takes the least amount of time. So after 30 seconds, I'm going to actually start reading it. And the way that you read it is that you compare the test sample to what we see here. So after 30 seconds, I want to just kind of get rid of some of that extra urine. Once again, this is simulated urine, so it's not real. And the way that you hold it is you notice that you have the handle toward the bottom, and you're going to start reading from the bottom up. So when I'm looking at this one looks like it's a pH of between 6.5 and 6. It's a little bit closer to 6, so I'd say that that one is a pH of 6. Protein looks negative. Glucose looks like it's in between a negative and 100. Ketone is negative and blood is negative. So that's basically what I'm doing, is I'm comparing the color of the squares to the color that we have here on the key. So again, when you do this, read from the bottom up, because usually the bottom one takes the least amount of time, and as you get up further, it takes, like, for example, pH is 60 seconds, and this one, blood, is also 60 seconds, but usually there's some that take 30 seconds to start reading. So when you read from the bottom up, you start reading the one that needs to be read immediately, and then by the time you get to the ones toward the top, they take a little bit longer. And the reason that you want to make sure that you do it in a timely manner is the longer that this urine sits, it'll actually start throwing different colors, because the strips now are exposed to air and are exposed to urine for a longer period of time. So you want to read it in the appropriate amount of time. So that's what we do for each one of the samples when we do urinalysis. Again, this one is only testing for 5 different substances. There's some urinalysis that test for 10 to 12 different substances, just depending on what strips you have. And then you're just going to go through and determine what these are. And then based on what your patient has and what their urine is showing, it may indicate that they may have something going on. For example, if there's glucose in the urine, it usually indicates that there's going to be somebody's got diabetes. So it's one of the first tests that they're going to do, and then they run further tests, but it's a starting point.